So we have the humeral head. So the most mobile joints have an angle of 120, and it is the most mobile joint. Now, the head of the humerus has about 5 structures, which are the hemisemipherecal head, hemi or semipherecal head, which is this region, this white region. Now we have the anatomical neck. So mind you, this is not the anatomical neck. This diagram is a bit wrong. Here, this region now is not the anatomical neck. We have the surgical neck, and we have the greater and the lesser tubercle. So what are they doing? We have the head of the humerus, which we know. So what is the head of the humerus doing? The head of the humerus articulates with the glenoid cavity of the scapula. So the head of the humerus, they form an articulation with the glenoid fossa of the scapula, and this head is bigger and protrudes medially. It extends medially. Medially is closer to the midline. So as you can see, it moves laterally to the medial side. It's hemispherical. It is larger than the glenoid cavity, and it is moving medially. Now, it articulates with the scapula to form a joint called the glenohumeral joint. So this joint called the glenohumeral joint is the joint due to the head of the humerus and the glenoid cavity. We have the humeral head articulates with the glenoid, enables unmatched range of motion, the most mobile joint in the human body. So if I ask you what is the most mobile joint in the human body, is what? The glenohumeral joint. Provides of angle 120 degrees, so they can extend to about angle 120 degrees. So the glenohumeral joint is the joint that is formed by the articulation with the head of the humerus together with the glenoid cavity. So we have the surgical neck and we have the anatomical neck. So mind you, the anatomical neck is not this. The anatomical neck is located in this region, and what is it doing? It separates the head of the humerus from the greater tubercle and the lesser tubercle. So they separate the head of the humerus from the greater and the lesser tubercle, and they are not prone to fractures. They are not easily destroyed. They are difficult to destroy. Now we have the surgical neck. So this region where the surgical neck is located, this region. So what is the function of the surgical neck? It separates the humeral head, the greater tubercle and the lesser tubercle from the deltoid tuberosity. So the deltoid tuberosity just provide area for attachment of the deltoid. So there is a V-like shape at the shaft of the humerus. So that V-like shape is what we call the deltoid tuberosity. And what is it doing? It's providing area for attachment of a muscle called what? The deltoid muscle. And there is what we call the intertubercular sulcus. What is intertubercular sulcus? Intertubercular sulcus separates the greater tubercle from the lesser tubercle. So this depression in this bone is called what? The intertubercular sulcus. What is it doing? It's separating the greater tubercle from the lesser tubercle and provide area for attachment of the biceps brachii muscle. And note that intertubercular sulcus is also called the biceptal groove. So we have the surgical neck, vulnerable transition zone, high risk for fractures and coexisting neurovascular injuries. So we have what we call the surgical neck, and this surgical neck are attached by so many arteries, the axillary arteries and so many other arteries. And this axillary arteries supplies the upper limbs. So this surgical neck are prone to fractures, meaning that this is one of the easiest part that is easily damaged in terms of the proximal end of the humerus. In terms of the proximal end, not in terms of the bone we have, in terms of the proximal end of the humerus. So the part that is easily damaged is the surgical neck, and they are attached with too many axillary nerves and so many other nerves that we attach here. So when injury occur here, it will lead to breakdown of this nerve, destruction of this nerve, and when this kind of thing occur, it might lead to palsies. It might lead to brachii plexus palsies, and brachii plexus palsies is the nerve that innervates the upper limbs from the axilla. So paralysis means when it starts malfunctioning, whenever there is injury that have occurred, it will now lead to paralysis where the part of the arm will not be able to move. We have the proximal humerus, anatomic tubercle, and the sulcus of the attachment. Remember that I told you the intertubercular sulcus. The intertubercular sulcus, what is it doing? It separates the greater tubercle from the lesser tubercle. Now, the greater, you remember that I told you we have what we call the rotator cuff muscle. Now, take a look at the rotator cuff muscles. So, what are the rotator cuff muscles? They help in movement of the shoulder region. So, they ask you, what is the rotator cuff muscles? The rotator cuff muscles helps in movement of the shoulder region. So, what are they doing? The rotator cuff muscles are four in nature. The rotator cuff muscles, they are four. What and what? We have the supraspinatus, we have the infraspinatus, we have the teres minor, and the subscapularis. So I use the word sit to master my own. SITS, sits. So let's go. S means supraspinatus, I means infraspinatus, T means teres minor, and S means subscapularis. Now remember the intertubercular sulcus differentiate or separate the greater tubercle from the lesser tubercle. Remember, what are tubercles? Wow, that is a nice question. Tubercles are area that provide area for attachment of muscles. So anything tubercle, tuberosity, they are rough and provide area. They are bomb-like structure. They have a rough edge that provide area for attachment of muscles. So when we talk about greater tubercle, mean it have area for attachment of muscle. So the difference between greater and lesser tubercle is the greater means it is larger and lesser means it is smaller. And the greater is more lateral and posterior. So you can say it is posterolateral. While the lesser tubercle is more inferior and lateral. So you can say it is what? Inferolateral. And remember they say that we have four rotator cuff muscles, and this greater, remember tubercle means they provide area for attachment of muscle. So this greater tubercle provide area for attachment of the what? The rotator cuff muscles, which helps in movement of the upper limbs. These rotator cuff muscles, three are attached at the greater tubercle and only one is attached at the lesser tubercle. So the three that are attached at the greater tubercle are called the seats, SIT, which is the supraspinatus, the infraspinatus, and the teres minor, as you can see them there. So these muscles are attached at the greater tubercle, while the only muscles of the rotator cuff muscles that are attached at the lesser tubercle is the subscapularis. The subscapularis is the only muscle that attach at the what? At the lesser tubercle. So this is the intertubercular sulcus, also known as the biseptal groove. What is it doing? It separates the greater tubercle from the what? From the lesser tubercle. Biseptal tendon guide subway track metaphor. And we have the intertubercular sulcus and the lips guide the bicep tendon smooth passage. So remember that I told you intertubercular sulcus provide area for passage of the biceps brachii muscle. So the biceps brachii muscles pass through this intertubercular sulcus, and the sulcus lip anchors. So the sulcus, the lip anchors pectoralis major, latissimus dorsi, and teres major. So what is the function? Convert shafts into the lever arm. And as you are moving downward, this intertubercular sulcus divide into lips, floor, medial, and the lateral lips. So the lateral lips, remember this is our humerus and this is our midline or the mid-sagittal line. So this is now my lateral because it is far away from the medial line, and this is now my medial because it's close to the medial line. So as this intertubercular sulcus starts moving downward, what is happening? It starts forming three things, which are the medial lips, the lateral lips, and the floor. So the floor will continue the brachii plexus to the arm and the forearm and the hand, while the lateral lips will now protrude downward throughout the shaft of the humerus to form what we call the deltoid tuberosity. So what is the deltoid tuberosity doing? The deltoid tuberosity is a V-like shape that provide area for attachment of the deltoid muscle. So if they ask you what is deltoid tuberosity, they provide area for attachment of what we call what? The deltoid muscle.